directions so as to achieve some specific outcomes like relaxation of the muscles, the skins, the tissue. This is the basic understanding of the Abhyang. So what are the benefits of Abhyang? It rejuvenates the body tissues, promotes good health, slows the aging process, relaxes the muscles and joints, relieves fatigue and body pains, improves eyesight and memory, nourishes the skin and body tissues, prolongs the lifespan, improves sleep and energy levels, improves the skin luster, and decreases stress and anxiety. Indications. Who all can go for full body massage or Abhyang? Healthy individuals who want to keep their body healthy, patients undergoing Ayurvedic Shodhan, that is detox therapy. Ayurveda has a 5-process detox therapy, that is Vaman, emesis, induced emesis, vomitings. Virechan, that is induced loose motions, induced purgations. Basti, that is medicated enemas, it can be oil based, it can be decoction based. Nasya, installation of the medications in the form of decoction, in the form of an oil, in the form of a powder into the nose for benefits in disorders related to the head, the nose, the ears, the eyes. In those disorders we use the nasal path to administer the medications. That is called Nasya. And finally is Rakta Mokshan, that is letting out the vitiated blood. It can be using a needle, it can be with the help of a leech. You might have a leech therapy session at the end of this program, which will explain how the leech therapy works and how we apply the leeches for blood thinning. So this is the 5 processes of detox in Ayurveda, which are called as Panchkarma. So patients who are undergoing the Ayurvedic Shodhan detox therapies, before undergoing these therapies, a full body massage is recommended. It may be for 1 day, 2 days or 3 days. 3 days is the max period that we administer full body massage to the Panchkarma patients. Depressed patients, patients who have mental illnesses, it can be depression, it can be anxiety, both, or it can be a tertiary illness. Full body massage or basically massage of the head and the feet combined gives marvelous results in patients with depression and anxiety. It relaxes the body and it also relaxes the mind, induces sleep, and it has many other benefits also. Aged patients, patients who have age and who have aging disorders, it is basically recommended that if you are 60 plus, you should at least go for a full body massage once a month. And it will slow down your aging process and it will relieve the symptoms that you are facing due to aging, like stiffness in the joints, reduced mobility, reduced flexibility in the body, loose skin, wrinkles and stretch marks. All of these things, they slow down, they reduce with the full body massage and things like that.
So you're recommending it's once in a month?
Once a month is for a help by our family and the children in our localities and in our knowledge, all are massaged. The massage gives benefits of proper growth and nutrition to the tissues of the body, and the body attains its proper growth potential. If the massage is not administered, sometimes some parts of the body, basically the knees in the earlier age group of the children, in the infancy, they have a tendency to bend inwards. That is called a knock knee, because the joints are not getting proper strength. That is why the arms, the legs, the chest, the back of the child are specially massaged so that they attain their full growth potential and there is no deformity in those organs when they start bearing weight. Emaciated patients, patients who are lean and thin, they can have a massage. Yes, sir.
How many sittings should be given to young? The Shirodhara, this body massage is also required.
That depends on the patient, as I said earlier. If the patient has a severe disorder, it will accompany Shirodhara, full body massage, and internal medications. We might do medicated enemas also. So it all depends on the patient. If it is just a mild anxiety disorder, a head massage can also work, a feet massage can work. If the anxiety symptoms are present in the whole body, like the patient is shivering, most of the times he is sweating a lot, he is anxious about things, then we can go for a full body massage. Patients with osteoarthritis, the classical symptoms, the classical features are majorly seen in the knees, but they can also affect your spine, they can also affect your hip joints, the ankle joints are also affected sometimes, and the small joints of the hands are affected many times in osteoarthritis. In osteoarthritic patients, Sarvanga Abhyang or localized massage of that part, full body or localized massage works very well, and is regularly used in our hospital for relieving those symptoms.
Same oil we will use in all conditions.
There are more than 500 oils which are in practice today in Ayurveda. Many companies, many pharmacies produce different types of oils. There are around 50 types of oils that are being manufactured in our pharmacy here in the college. So every region has different types of oils in practice, and every pharmacy, according to its region and according to its background, develops many types of oils. Any oil can be used for massage. You can use plain sesame oil, plain mustard oil, you can use coconut oil, you can use desi ghee, you can use animal fat. Anything can be used, but the properties that it delivers to the body tissues, the benefits that you get will vary according to the oil or the fat used. Now the contraindications, who should not go for full body massage? Patients suffering from indigestion. If you have an indigestion which is acute, as you had a meal in your dinner and it did not digest properly and you are having a heaviness right now, you should not go for a full body massage. That is an acute episode of indigestion. Secondly, if you are suffering from continuous indigestion since a month, that after having your meals you are feeling bloated, you are having a lot of burps, and there is gas formation and you are not feeling comfortable after meals, proper digestion is not happening, in that scenario also you should not go for a full body massage. Patients suffering from fever, if you have a fever, either acute or chronic, you are suffering from fever since last night or you are suffering from a month, you should not go for a full body massage.
Excuse me.
Yes.
Sir, you talk about patients suffering from indigestion.
Yes.
Most of the patient is always suffering from indigestion. Then how can we go for the
Once the patient enters the Ayurvedic OPD, the Ayurvedic hospital, the Ayurvedic physician's chamber, the first thing we do is cure the indigestion of the patient.
Then
Once the digestive fire is working properly, then only we administer any therapy onto the patient. If the digestive fire is not working properly, none of the therapies are recommended.
Okay.
That is the principle of it.
Sir, what are the side effects if we are giving massage to fever patient suffering
You can see
fever
there are
patient?
two types of fevers basically. One fever is of the type in which the patient feels that everything is very cold and he shivers. And in the other type, he feels everything is very hot and the surroundings are very hot and he wants something cold onto his body. So in both of these conditions, application of a tertiary element which is not soothing to the patient's present condition is not recommended. In Ayurveda, if the patient is suffering from fever, in which he feels everything is very hot and the surroundings are very hot, his body is very hot, application of chandan lep, sandalwood lep, the application is used, ointment form, or it can be in the form of I would say paste, thin paste. And in the conditions when the patient is saying that everything is very cold, the surroundings are cold and he feels cold, he is shivering, application of agar wood, agaru, as we call it, agarbatti. So agar wood paste is used for application on the body of the patient so as to heat the body. So we use those therapies in these patients and we do not go for full body massage. And next is hyper obese patients. Anyone who is very obese cannot undergo full body massage because he will start getting palpitations while the process is going on. He might become uncomfortable, he might sweat a lot during the Abhyang. So it is better to accustom the patient firstly to sauna therapies, that is Sweden. Once the patient is okay with that, the profuse sweating is fine for him, then he should go for the full body massage. If we go with the full body massage straight on, he might not be able to tolerate it nice. Pregnant women, in pregnancy, any of the manipulations of the body are contraindicated. There should be no manipulation of the body. Light oil applications can be done, but it should be left to an expert in the field and should not be tried in the first go. Once you are experienced, then you can handle that. Ladies during menstruation period, during menses, there are some sort of secretions always coming out through the private parts, and once we are in the massage chamber, we do not want any secretions from the patient. That is why patients with skin disorders, as you can see in the third last point, patients with any infections, acute inflammations, they are not recommended for massage because they may infect the therapist, they may infect the equipments, the tables, etc. And they might also lead to transmission of diseases into the private parts of the patient. So these patients are not recommended for body massage. Patients with open wounds, anyone who has an open wound and ulcer or healing ulcer, I would say, should not go for a massage. First, the ulcer should be healed, or that part can be left off. It could be covered, it could be bandaged before the full body massage takes place, and it should not be irritated while the massage is. Point dislocation patients who had undergone joint dislocations. In those cases, full body massage or massage of that part should be avoided, as only a trained therapist can massage that part and relocate the dislocated joint, or go for a plaster in the case of a fracture patient. Patients suffering from skin disorders, I already elaborated, because of a risk of spreading the infection to other people, or irritating the present infection in the patient's body. Patients with acute inflammation, active bacterial and fungal infections. Requirements. Now, these are the things that we require for a full body massage. First is the Abhyang table. It is a special table, as you see in this picture. It has a texture to it which helps in the drainage pattern of the oil. Once we start pouring the oil onto the patient in full body massage, the oil is used in large amounts. We do not use less amounts of oil. Oil in, I would say, 300 ml, 400 ml, 500 ml amounts is used onto the patient, and much of the oil leaves the body and drips down. So this specially designed table helps with the drainage of the oil and collection of the oil, and it does not lead to any spillage onto the floor. Hot water facility, it can be a geyser, it can be an induction, it can be something else. 2 to 3 bowls, 250 ml capacity, which are used for handling, heating and pouring the oil. Soft towels to wipe the patient off after the massage is done. Medicated oil, 100 to 150 to 200 ml capacity bottles is available in our pharmacy, and that is what we try to use in a regular practice. But in many cases we need around 2 bottles. So as I said, 300, 400 ml oil is commonly used, but we try to limit it to 200 ml. Bengal gram powder, it is chana dal powder in India. Yes, or we can use besan also. And the application is used to remove the oil that is left on the skin after the process is done. 2 therapists, at least 2 therapists are needed. You can do with 4 therapists also, because it is a cumbersome process, and it takes 1.5 hours. So the therapists wear off in around 25 minutes. If he is an unexperienced therapist, as you will all see, this is the first time that you are doing full body massage, you will all feel very fatigued after standing for 25 minutes and doing the maneuvers on the patient's body. So we regularly need 2 therapists for full body massage, or we can do with 4 also. Preparations. Light and nutritious diet 1 day before the procedure. As I elaborated earlier, there should not be a case of indigestion on the Abhyang day, on the full body massage day. Thereby, light and nutritious diet is recommended a day before also. Nil per oral 2 hours prior to the procedure. So in regular practice, we ask the patient to come without eating anything in the morning. He can have water, he can have milk or tea at maximum if the patient is. But it is recommended that he does not take anything in the morning, and he comes for the full body massage first thing in the morning. But if you are trying to do the Abhyang or the full body massage in the evening hours, in any time except the early morning time, then the patient should not have had anything at least 2 hours before the procedure, or 4 hours is a better bet, I would say. The patient should be counseled about the procedure, the benefits, etc. Everything should be told in advance to the patient, that he needs to bring his own towels, his undergarments need to be in extra pairs, and the patient should be explained about the massage, the techniques used. Sometimes patients have a tendency to of boil formation when the massage happens. So if the patient says, I have a lot of hairs and my hairs start getting pulled when the massage is done, in those cases we use extra oil and extra precaution so that this case does not happen. Otherwise, in many cases, the patients come up the next day with boils on hairy parts in the body, because the hairs get pulled and the roots get infected, the follicles get infected. The patient is asked to avoid the urges. He should avoid the urge of urine and bowel if there is. And to begin with, the patient is asked to undress to minimum clothes and lie down in supine position on the Abhyang table. There are 2 basic positions. One is the supine position and second is the prone position. I hope you all know those positions or not?
Yes.
So supine position, I would elaborate, is the position in which we sleep facing the roof, facing the ceiling. And this prone position is in which our face faces the table. So these are the 2 positions in which we can lie down on the couch, face up or face down. Oil is heated with water bath, and then it is smeared on the body from scalp to toes. Since it is a full body massage, the oil needs to be smeared from the scalp to the toes. Now we come to the main procedure. Uh, there are 5 postures of massage that we use in a continuation in a circle so as to cover all of the body parts. They are sitting upright with knees extended. I cannot elaborate all of the procedures in these slides. They will be elaborated when we are in the hands-on training. But one is sitting upright with knees extended. So you can all see if a patient is lying down and he sits up without folding his knees, his legs are straight and the body is sitting up. So this is the first position. Sitting upright with your legs straight, knees straight. Supine position is lying down with face towards the ceiling, body flat. The position that you see here is the prone position, face down position. Then is the left leg position. The patient has turned to his left side. The last is the right lateral position. The patient has turned to his right side. So in all of these positions, we massage the body parts of the patient and try to cover each and every aspect of the body. Main procedure, techniques for Sarvanga Abhyang. First is the head massage. If a volunteer from all of you can come on the stage and I can explain the therapies to others from that also. Thank you very much. Please try to keep your head stable. We try to cover the scalp from before backwards. Movements like these are appreciated. The oil spreads to all of the parts of the head. I am not applying pressure right now because this is just a demonstration. While we are in the full body massage, I will try to explain with full pressure onto the patient. So this is the technique of before backwards. Then is picking strokes. If any one of you has gone through head massage, they might know these strokes. These are called picking strokes, as if we are picking something from the scalp. These are called picking strokes, and this is the second step that we follow in a head massage. There is flat palm strokes. In flat palm strokes, we give strokes with the flat of our palm without the use of the finger. And it is not supposed to be done in patients with cervical disorders, with pain in the neck or other stuff. These are the strokes that we administer to the patients. Flat palm strokes. Here the palm is used, not the fingers. The fingers are just. These are the flat palm strokes. They can be alternatively given. They can be given together also. While we are in the procedures, we will learn these techniques better. Then is the squeezing strokes and the pressing. Pressing is just pressing onto the scalp. You can press onto the scalp. This is called pressing. Pressing with your fingers and your thumb. Pressing. Earlier it was the picking strokes like these. Now it is the pressing. I am not picking anything. I am trying to press onto the scalp. You can also do it on the forehead. You can press the forehead. So this is the pressing. And then there is a squeezing technique. In the squeezing technique, we try to hold the hair and squeeze them. We try to hold the hair and squeeze them. It is gentle squeezing. It is not pulling. It is not trying to pull the hair out from the scalp. It is just to relax the scalp and to aid with the circulation of the scalp. So these are the techniques that we use on the scalp. Last is the pillar. The external ear, this is called pillar. So you can twist it. You can rub it. From the inside, from the outside, you can press on the triggers. You can pull on the tubing. These are the techniques that are used for massage of the ear. It is not a specific technique. It is whatever you can do on the ear, because ear is a very small part and it does not give much space for techniques and all. So this is a small part. So vertical strokes from above downwards with the flat of our hands, and from below upwards with the flat of our hands. So these are the two major strokes that we gave on the neck, and then flat palm strokes on the back of the neck, on the back of the head. These are the only maneuvers that we have to do. Sir, please sir. Then in this direction, from above downwards, or they can be from below upwards. These are the vertical strokes. Then horizontal strokes with the flat of our thumb. They can be in the lateral direction or they can be in the medial direction. These are the strokes given on the forehead. Linear strokes on the nasal bridge and sides of the nose. This is the nasal bridge. The central part, it is the nasal bridge. So you can go with linear strokes on the on the nasal bridge, and linear strokes on the sides of the nose. From above downwards only, not from below upwards. Then horizontal strokes on the upper lips. On the upper lips, as you can see in that diagram, strokes in this manner or strokes in this manner can be given. They are horizontal in nature, parallel to the ground.
Sir, we choose one direction only.
No, we
If
can do it
we
both
are doing
directions.
like this, then
Once we start doing in one direction, then we do in that direction. After some time, we can repeat it in the other direction also. But we will not go in both directions at the same time.
Only for the nose we have to have one direction.
Yes, on nose we have only one direction. That is from above downwards. Circular and horizontal strokes on the maxilla. The maxilla is the part that is attached to the cheeks. So horizontal and circular strokes. This is the horizontal part and this is the circular part. Horizontal and circular strokes on the maxilla. Circular strokes on the cheek and the thinner with the thinner eminence. On our hand, the part that is raised below the thumb, this is called the thinner eminence. Some people call it the thinner eminence. So this is used to massage the cheeks. The patient is asked to hold some breath in his mouth. Also, please, you can yes, off your face a bit. So we massage with the thinner eminence on the cheeks and the maxilla. But there needs to be some substance in the mouth, or the patient needs to puff his mouth, because otherwise you might be rubbing onto the bones harshly and the patient might be discomforted with it. And I would recommend that patients with the beard should not go with face massage, because the hairs on the face, the hairs of the beard and the mustaches, they might be pulled during the procedures. Horizontal strokes.
possible in Punjab.
I am using my thumbs. On the lower aspect I am using my fingers, and these are the horizontal strokes that we do on the medical. I hope everyone can see clearly.
Yes. Not so clear.
Now we can
Light.
Dr. Jyoti, please help with the lights. Now we move on to the arm and the shoulder massage. This is basically the upper limb massage. Circular strokes on the shoulders. So when we come to the shoulder, once we covered the scalp, the face, the neck, then we come to the upper limb. On the shoulder, circular strokes are given. On all the major joints of the body, the shoulders, the elbows, the knees, the wrist, the ankles, circular strokes are given. Even circular strokes are given on the small joints of the fingers. So circular strokes in clockwise and anti-clockwise manner, both are done on the shoulder.
How many times?
That depends on the total time given for the full body massage. If you are given 1.5 hours for the full body massage, you can go for 5 to 7 minutes on a specific point. But if you are given only 40 minutes, that is the shortest time possible, you are just left with 2 to 3 minutes on a specific point. Circular strokes on the shoulders, linear strokes on the upper arm. When we are dealing with the upper arm, we need to hold the arm. So please relax your arm. So these are the linear strokes that we give in one direction at one time, as I am going from above downwards now. Then I can go from below upwards in the second step. These are the linear strokes. But I need to hold the arm comfortably, and the patient should not feel the weight of the arm being lifted. Circular strokes on the elbows, as I elaborated on the shoulders. Similar is the case with the elbows. The elbow has two parts. One is the external part. We should support the lower side with the other non-dominant hand and massage the elbow in circular fashion on the external aspect in clockwise, anti-clockwise, both directions. Similar is the case with the inside. We will support the other side with the other non-dominant hand and massage the inner aspect. All the joints need to be covered in a circular fashion. Linear strokes on the forearm, as in the case of the upper arm, in the forearm also we will give linear strokes, and then circular strokes on the wrist. In the case of the wrist, we will give circular strokes, supporting the other side with the non-dominant hand, and similarly on the inner side also. And on the forearm, we need to hold the arm of the patient and give linear strokes, firstly from above downwards and then from below upwards. Linear strokes on the metacarpals. The metacarpals are the bones that join the wrist with the fingers. The bones that lie in the flat of our hand. These are the metacarpals. So linear strokes are given on these bones in this fashion. With our thumb on one side and fingers on the other side, we pull onto these bones, the flesh on these bones. This is linear massage on the metacarpal. It can be done on both sides. This is the linear massage on the palm and the linear massage on the metacarpal. Linear and circular strokes on the fingers. The only stroke that is possible on the fingers is pulling the fingers. So this is the milking of the fingers or linear strokes on the fingers. And when we are done with the milking of the fingers, the circular joints should be rotated in this manner. These are the circular strokes on the joints of the fingers. These are the only strokes that are possible on the fingers. Then circular strokes on the palm. On the palm we have a flat padded surface, so we can hold it like this and give circular strokes in the clockwise and anti-clockwise manner on the palm. And last is poking maneuver on the palm. You can poke the palm. There are special points in other therapies in naturopathy and other acupuncture which aid with the functioning of the body organs. But in Ayurveda we are not explaining those points, so we just do the poking of the palm. It can be done on the sole of the feet. So these are the maneuvers that are done on the upper limbs. Then trunk and back of the limb on the side of the spine. Circular movements can be done. They can be both clockwise and anti-clockwise. Then is linear strokes on the back. On the portions that are related with the spine on the back, only linear motion should be done with the thumbs, with the flat of the hand. This is the upper back, up to the point where the ribs are present. So here circular strokes can be given in both fashions, anti-clockwise and clockwise. But when we are dealing with the central part, that is the spine and the related muscles, only linear strokes should be done. It can be done with the flat of the hand as normal, or it can be done with the thumbs also. Poking maneuver on the back. Poking should be done very cautiously on the back because you might injure a nerve that is coming from the spine, and so it is not advised that you go with the poking in the first step. Once you have done quite a few massages, then you can go with the poking on the back part.
How?
But the poking can be done on the scapular parts easily. These are the scapular bones. As you can see, I am drawing the scapula over here. This is the wing bone, you can say, or the bone that connects the arm to the shoulder. Poking can be done on the muscle, on this bone, without any chance of damage to a nerve or any other important structure on the back. But once you go onto the spinous part, this is the dangerous part. You should not go there in the first step.
So height over the whole scapula we can do it like
Yes, on the whole of the scapula. On the whole of the scapula. Then circular strokes on the chest. Similarly, as on the upper back, we can do circular strokes on the chest of the patient. In males, in females, both circular strokes are given, but the position and the pressure varies in both males and females. Circular strokes on the abdomen. On the abdomen, massage should be done only in the clockwise fashion. Never in the anti-clockwise, because the intestines go in the clockwise fashion. And if you start doing the abdominal massage in the anti-clockwise fashion, then the patient can end up constipated, because the movements of the intestines will be disrupted.
What is the direction of poking? Poking direction?
Clockwise.
Clockwise only.
Only clockwise. Then is leg and hip massage. Circular and linear strokes on the hip. The hip and the buttocks. Then circular and linear strokes on the hip. On the hip joint, on the lateral side, circular strokes are given. As on the buttocks, on the lateral side, circular strokes are given. But on the front part and on the lower side of the thigh, or the lateral side of the thigh, only linear strokes are given. Linear strokes like these. On the front, on the side, on the interior sides, only linear strokes are given.
Similar on the butt cheeks.
On the butt cheeks, we have to do circular strokes. On the hip joint, laterally, we have to do the circular strokes. On the anterior aspect, the lateral aspect, the inferior aspects, the Indian aspects, we have to go with the linear strokes. Then is poking maneuver on the thighs. On the thighs, poking can be done, but it is recommended to do the poking on the posterior aspect. As you can see in the picture above, poking is being done, but that is on the posterior aspect because that is the part which has more muscle tissue, where poking benefits. If you start poking on a bony surface, the patient will be agitated, he will not cooperate with you during the massage. Circular strokes on the knees, as knees are a joint, we will need to support the knee from one side and do the circular movements. As in this case, I will support the knee. The patient should be lying on the table. I will support the upper surface and then massage on the upper side. While the patient is lying face down, I will hold the knee from the front surface and massage on the back surface. Linear strokes on the calves. The calves are a flat part. Linear strokes can be given on the front of the calves, as you can see in the picture below. That linear strokes are being given on the calves. They can be done on the front and on the posterior surface both. Circular strokes on the ankles. In the case of the ankle, we need to hold the ankle from one side and provide the circular stroke on the other side. No circular stroke will be done on the anterior or posterior aspect. Only lateral and medial aspect will be covered. Techniques for Sarvanga Abhyang on the foot massage. Foot massage and head massage, they are different parts, generally not covered in a comprehensive full body massage tutorial, but here, because we have short time, 7 days only, so we are covering it in full body massage. Foot massage has many more techniques also than the ones that I have explained over here, but I will explain to you the brief metatarsals. As in the hands I explained, metacarpals are the bones that attach the wrist to the fingers. In your foot, the bones that attach the ankle to the toes, they are known as the metatarsals, the long bones of the foot. So linear pulling on those bones is done, and that is the linear strokes. Linear and circular strokes on the fingers, that is pulling onto the fingers and rotation of the small joints of the fingers. Circular and linear strokes on the sole, as on the palm of the hand, on the sole of the foot also the circular massage techniques are used. And also the linear stroking of the metatarsals can be done on the sole of the foot also. And lastly, the poking maneuver on the soles, as on the palms, poking can also be done on the soles of the feet. These are the general steps. There are many other steps. There is a kneading technique that is done on the foot. It off with a warm and damp towel. So the oil that we use in excess during the full body massage therapy needs to be taken away from the body because the patient will not be comfortable unless the oil is removed from the body. So the gram flour is applied to the body. It soaks the oil. It takes the oil in itself, and a damp warm towel is used to wipe it. The patient is advised rest for 20 to 30 minutes in a temperature controlled room after the procedure. You should not straight away go for a bath after the procedure. Be it a bath with hot water also, you should not take the bath straight away. And you should not go into an air-conditioned room which is cool in temperature after the therapy. You should rest in a climate-controlled room in the same temperatures as you were experiencing during the massage for around 20-30 minutes, so that the body relaxes and the heat generated during the procedure dissipates, and then you can go for a bath with the warm water. Like around 20-30 minutes is a good time. You can also rest for around 45 minutes. Thank you. Almost all of the pharmacies produce this oil and can be used in any of the skin conditions, in any of the pains, in any of the lax tissue disorders. In cases of paralysis where there is degeneration of the body tissue and the parts become lean and thin, Mahanarayan tail can be used anywhere without blinking.
Patients having the problem of osteoporosis and a lumbar L4, L5 was totally damaged. Then we can use this kind of therapy.
Yes, we can do this therapy, but if in the case of osteoporosis there is vertebral fractures and the fractures have been compromised, only osteoporosis is no bar for Abhyang therapy. Only in the case of fractures of the vertebra, we should avoid the massage. Yes.
What is the component in one Abhyang?
It is not just one component, it has more than 30 components, so it will not be possible to explain those here. You can search it on Google also, you will get it. It is sesame oil. Yes.
Sir, can we use this all in all the Panchkarma therapies?
In all the therapies that you are going to learn, majorly we can use this oil. Majorly, in I would say 80% of the therapies you can use this oil.
Mahanarayan.
Mahanarayan. There is also a lesser variant that is called Narayan Tel, that is also available. But the Mahanarayan is the general one, it is the one that is commonly used. Then secondly is Dhanvantram Tel. Dhanvantram, Dhanwantram. Dhanvantram. KSHEERBALA. Tel. So the Sheerbala.
Sherbala.
Sheerbala. So these are the common oils that you can use in almost all of the disorders without thinking, and they will give you good results. But other oils that have medicinal herbs which can damage the patient if given without a prescription, they should not be used without thinking.